Thank you all for joining us today for the Frameworks webinar, How to Counter Public Health Myths and Elevate Science Now. This is a really important conversation to have right now, and we'll get started in just a moment. We've put up a poll here about the work that you do, so please take a moment to respond, and we'll share those results so you can all get a sense of who's in the room with us today. I'm Sherry Johnson. I'm the director of the Population Health Institute at the University of Wisconsin-Madison. I'm also a Frameworks board member. Frameworks published a fact sheet in November of 2024 with a few important reminders about mindsets that caught my eye. I especially appreciated bullet number 4 in the fact sheet, which notes that, quote, people hold multiple mindsets simultaneously. So while there's a lot of focus currently on polarization and divides, let's remember that we are all complex. And as we work to implement foundational public health services, let's also remember that these capabilities include establishing and maintaining trust and authentically engaging community members and populations most impacted by inequities in key public health decision-making. Framing strategies that we will learn about today are key to building these capabilities across the public health and healthcare systems. So we'll show the poll results now so you can see who's in the room, and I'll go over a little bit of housekeeping. The chat will be closed for the webinar, and we'll use the Q&A box for questions from all of you. Please feel free to submit your questions at any point during today's webinar, but we'll wait until the end of the presentation to answer them. Today's webinar is being recorded, and we will share the recording with all of the registrants in the coming days. We'd also like to ask you now to share how you're feeling at this moment. You'll see a link in the chat to participate in a word cloud activity, and there are 3 questions there for you. So if you would, please take a moment to contribute, and Julie will share the results at the end of her presentation. So now I'd like to introduce today's speaker, Dr. Julie Sweetland. Dr. Sweetland is a sociolinguist and a senior advisor at the Frameworks Institute. Since joining Frameworks in 2012, she's worked with dozens of partners to design and lead reframing initiatives on many public health issues, from vaccinations to health justice to effective communication about science. So welcome, Julie.
Thank you, Sherry. And thanks to you all for joining today. It's good to be with you. Any of us who are watching the national political conversation on health unfold are likely trying to make sense of the dizzying array of unorthodox, unsupported, or unsound positions and ideas that are being elevated. I know I am certainly trying to make sense of it. And in reflecting over the last few weeks and thinking about the wealth of research we have to offer here at Frameworks Institute, I feel that it's safe to say that there are things that we can do to respond effectively and meet this moment. As voices for public health, whether we're practitioners, researchers, or others, we can do the following in these uncertain times. We can understand the mindsets that are being unsparked and reinforced by the national political conversation on health. We can avoid communications traps or habits of communications that make sense to us, but fall flat or even backfire when we look at the evidence for how they land. We can use tested and effective strategies for explaining newly prominent or politicized health topics. We can manage misinformation with proven and promising practices. And we can do all of this together. We can cooperate and coordinate on efforts to elevate public discourse and communicate effectively. So these are the strategies I'm going to walk through today. Again, I'm so glad you all are here. Please enter your questions into the Q&A. Fill out the word cloud. We want this to be as interactive as we can manage with, close to hundreds and hundreds of folks on the call. And certainly we're thinking of this as the start of an ongoing conversation, not the only conversation we'll have. So getting right into it. It's really important that we think about the mindsets that the public has, that are widely shared, and that current topics, health topics that are prominent in the national conversation on health and health policy right now, are tapping into and reinforcing. So, for instance, if you're watching the news on health-related cabinet nominees, it feels like ideas like this are all over the place. Vaccines, food additives, fluoridated water, Ozempic, raw milk. What do these even have in common? Well, one answer, of course, is that the current nominee for HHS secretary has expressed a position that's at odds with the current policy, practice, or position of the agencies he's poised to lead. But another answer has to do with the hidden cultural logic that binds these seemingly, divergent topics together, and how that can help us make sense of why these positions appeal to many Americans who hold very different opinions on other topics. And at Frameworks, we look at the patterns in public thinking through the lens of cultural models or mindsets. And so in this section, I'll be talking about mindsets, particularly the mindsets that underlie the diverse range of this diverse range of health policies and topics. So, what do I mean by mindsets? The study of cultural mindsets, sometimes called cultural models, comes from the field of cognitive anthropology. Cultural models, like train models or airplane models, are simplified representation of how something works. They may be incomplete or outdated, but they're recognizable and plausible. And they have four key characteristics that make them a powerful way for us to understand people's reactions to socio-political issues. They are deep. They're implicit understandings, assumptions, and patterns of reasoning that shape our thinking in ways we might not be consciously aware of. They're widely shared. Lots of people across demographics, across opinion groups hold them. We all hold multiple models of the same topic, and which ones get recruited to make sense of a topic in any given moment is, in part, contextual. These cultural models or mindsets are there's many of them in mind, and they get pulled forward by context, such as the framing of the information we're exposed to. And the reason all of this matters, and the reason we ground our work in cultural models at Frameworks, is that they structure the way people hear, understand, and interpret an issue. So, for example, take the American cultural model of consumerism, which is the idea that we get access to goods and resources through buying and selling things. This is a deeply held model. We all, and widespread, we all rely on this assumption all the time without even thinking about it. We might not be conscious that we're applying this cultural model to think and talk about an experience or issue. And it's not that it's entirely wrong. I did, in fact, buy the coffee I drank this morning. But what happens when this way of buying and selling way of seeing the world gets applied to everything? What do we miss or lose as a society when we think of things like education, healthcare, or water through this consumerist lens? And so that's why we think of the importance of people having multiple mindsets is a way for us to push forward on an issue when a mindset doesn't help us understand a social topic or complex topic in a productive way. So, for example, the same person may view healthcare through a consumerist lens when there are doctors running late, bad customer service, right? But they may think about it as a public good when they're thinking about the needs of society. So there's multiple models, and they are brought forth by context. And which one is active is dependent on the kinds of ideas we put in front of folks. And these really matter because some mindsets open people up to new ideas, effective solutions, invite people into productive public conversations. Whereas other mindsets close down conversations, shut down deliberate thinking, and lead people to ineffective or mismatched policy ideas. So I'm going to go through some mindsets that I think are particularly salient in the public conversation right now, and use it to make sense of kind of what we're seeing in public reaction around certain topics just now. So, for instance, one model of government as a monolith. This is the idea that government is a nameless, faceless entity, impervious to change. I'm going to walk through the cultural logic that flows from this, and I just want to say before I do that, I'm not defending these ways of thinking, nor am I attacking them. My purpose is to make sense and help us all make sense of these patterns of thinking that lead to different conclusions than, say, the scientific method in which public health is grounded. And my goal is that we can all be more thoughtful about how to understand and navigate this moment. It gives us a space from which we can understand thinking that we might otherwise just casually dismiss as illogical, nonsensical, malicious, or otherwise out there. I don't want us to understand this thinking so we can have a strategic response. I'm not trying to suggest that we concede the public square or public policy to these ways of thinking, or that we change our values or give up on fighting for the things that we believe are important. But rather, I think, again, understanding these helps us make sense. And from that place of understanding, we can have a more purposeful response. So government is monolith. The bureaucrat on the snail here, I think, says it all. If we think about the model itself, that government is this nameless, faceless entity, and it's impervious to change. The implications of modeling, of saying that's what government is like, well, people think of it as big, formal, and impersonal, and it moves, if at all, by inertia and slowly. And so the surface level opinions and reactions that can be show up from this deep underlying model is the opinion, well, it shouldn't be that way. Government should respond to actual people. And this helps us understand why in elevating recognizable personalities to a high office can be for some reassuring, perhaps even inspiring, right? So that's one bit of cultural logic I think we're seeing at play in this political moment right now. These are some models that I think are really just becoming stronger and more salient, certainly being tapped into and reinforced right now, they cue and connect these four mindsets in particular. And we found these in our research on a range of topics: sustainable agriculture, oral health, vaccination, et cetera. And so I'll just walk through these a little bit, and then talk about how they play into some of the topics that we're seeing in the news these days. So one is that nature and humanity, right? Nature and human society are distinct and in opposition, and that nature is better than what's human made because it's unadulterated and healthy. And in this model, human intervention pollutes and defiles nature, certainly messes with it and perhaps messes it up. A second model is the threat of modernity. This is the assumption that social conditions were safer, simpler, somehow better in the past, and that because new ideas or new technologies and social arrangements are untested, they might be dangerous. And so we should approach those ideas in the future with extreme caution or fear. This way of thinking sometimes draws on that natural versus human made model, and that modernization is seen as moving further away from nature. A third model, bodily purity, involves the assumption that keeping unnatural substances out of one's body is beneficial physically, mentally, and perhaps even spiritually. I think this model is interesting because it's expressed both through, say, crunchy granola organic mom culture, like me, or as a holistic. It kind of comes through as a holistic emphasis on self-care and natural remedies. But it's also expressed through some Christian conservatives' beliefs in abstinence from substances, premarital sex, and other ways of maintaining a natural purity that's about honoring the body as a temple. I'm just pointing that out because to point out that they're widespread, right? Many people hold them, even though we might consider those groups to be quite different in their thinking in many ways. And then finally, bodily autonomy. This is simply the belief that individuals should be free to choose what enters their body. So these are kind of all over the place, but I think they help us make sense of, for instance, the vocal and even hostile reactions to the COVID-19 mandates. That these mindsets help us think through that. So there's a new vaccine. Well, by definition, it's a human invention, and humans are fallible, so there are unknown risks. Threat of modernity. There are so many vaccines today. Who's to say we haven't lost track of what they do or lost control? Bodily purity. To protect yourself, it's best not to let that untested artificial substance into your body, but that can only be achieved through bodily autonomy. So the opinion or the action that comes from that is we must strongly resist any threats to bodily autonomy now and take steps to preserve that autonomy in the future. We can run through the same kind of cultural logic with fluoride. And again, I'm not saying I agree with these or that they are completely evidence-based, but they are widely shared ways of thinking, and we should understand them. So fluoride, well, natural and man-made. Even if fluoride is naturally occurring, we're introducing it at artificially at human-determined levels. Threat of modernity, we're exposed to so many chemicals that we were told at some point were safe, but that wasn't always right. And sometimes our inventions and interventions have caused harm. Maybe this one does too. Bodily purity, to protect yourself, it's best not to let that artificially introduced substance into your body. And then bodily autonomy, that can only be achieved through that bodily autonomy. And putting fluoride in the drinking water supply is akin to forced medication in this way of thinking, and that violates bodily autonomy. All of these models exist alongside and in relationship to a highly dominant, incredibly widespread model that we are seeing gaining in salience and strength. And this is the assumption that the system is rigged by people in power for their own benefit and at the expense of the common good. Our research, particularly through our culture change project, suggests that this mindset is shaping public thinking on all sorts of socio-political issues, from the legitimacy of the Supreme Court and the feasibility of our democratic experiment to kitchen table issues like healthy food and affordable housing. It is a widespread model. You can see here, this is a highly dominant idea in a forced choice question where people only had, two choices. They had to pick yes or no, thumbs up or thumbs down in this particular survey item. You can see that 70% of Americans agree with the idea that the system is rigged. Now, who's rigging it? What is the system, and who is not being who's getting the raw deal as a result? That's something that's very much not widely shared. It's people have that's where somewhere we see some of the polarization, some of the differences we might expect. And so what fills in the blanks on this model, I think, is leading us into the next section of my comments today, which is right the way we activate or deactivate these multiple models, the way we fill them in or leave them be, really has a lot to do with the way people think about the issues we're hoping to advance. So the question is, how can we tap into productive critiques of power and systems, whether that's aspects of healthcare financing that boost insurance companies' profits but don't provide access to quality, affordable care for many Americans, or whether that system is systemic racism that's channeling stressors and toxins into many communities of color, but interrupting the flow of resources like good jobs, good schools, good food, and good places to live, right? There's a way to fill in this model and work with this model that's, I think, in the interest of justice and inclusion. But there are ways to fill it in that lead to xenophobia, anti-Semitism, conspiracy thinking, all sorts of things that I think are often at odds with our desires for public health. So working, with understanding the mindsets and how we can react to them and navigate them, I think is going to be key to elevating the public discourse and leading a more productive public conversation in the weeks, months, and years ahead. So understanding that these mindsets have a big sway, right? They are part of our political discourse and our public conversation, and thinking about how to work with them is going to be critical. Sorry, I've gotten lost in my slides here. So understanding that when there are voices that are resonating with or reinforcing these highly dominant models, if people can easily understand what they already think, right? If it sounds familiar, it sounds like common sense, that's something people are going to be more likely to agree with. Remember, these cultural models, like those train models or airplane models, they're simplified representations. They're not completely wrong. They're recognizable. They're plausible in some ways, but they might be incomplete, outdated, or just not suited to the issue. They might have gotten recruited, right, for the wrong job that day. But what that means about what we can understand about who's gaining a voice and who's gaining a voice in a platform, messengers who can fill in those blanks, right, in that incomplete model, or who can tap into several connected models at once, they're often going to be judged as insightful and credible. And so keeping that in mind, I think, is going to be part of our response, and important part of having a strategic response. All right. Second part of having a strategic response is avoid stepping in it. And by it, I mean communications traps. Communications traps in our little lingo here at Frameworks are plausible and logical ways of talking about a social issue. They seem completely like should work, sort of thing. But upon investigation, if we do the testing, if we do the social science research, they turn out to either fall flat, they're the same as saying nothing, or they can even backfire, doing more harm than good, sending people in the exact opposite of the direction we were hoping they would go. These traps are often habits of a field. They're things that we have seen modeled time and again. They're the ways we were acculturated into, right, the field of public health or whatever field we may be working in. And so they can go unnoticed until someone points them out. So here I am to point them out. I think these are 4 traps that are going to be really important that Voices for Public Health take care to navigate and avoid in the weeks, months, and years ahead. First of all, direct rebuttals of partisan figures. We should remember that this is often shown to increase my side bias or confirmation bias. So if we say that person, right, who has a known political affiliation is wrong, is bad, is out there, whatever that is, we can see what that is going to do is anyone who is already aligned with or leaning toward that person, they move further away from our position and closer to the position of that figure. Whereas if we address the mindsets at play, if we explain things in a different way, many of the persuadable folks will follow the line of logic and will be more open to our way of thinking. So working at the level of ideas rather than working at the level of the individual figure, I think is more likely to depolarize the issue and attract more supporters to the public health point of view. So again, address ideas, not the people who are sparking, reinforcing, or manipulating unproductive mindsets. A second trap can be framing with scientific authority, saying things like the science is clear or the science is on our side or there's no doubt in the science. Any of that is really relying on an appeal that's based on science almost as a value, that the reason my point of view matters is because science said it did. This taps into a whole lot of unproductive stuff. It can, again, be polarizing. It doesn't mean we should give up on advancing or communicating the scientific point of view. In fact, it is more essential than ever that we do so. But using the science said that as the lead message and as kind of the reason why people should care and agree with us is short-sighted. And we've got better alternatives, which I'll go through in a moment. Similar, saying this is a matter of public health, that X is a public health issue, vaccination is a public health issue, climate change is a public health issue, racism a public health issue. If you understand what a public health issue means, then yes, all of those statements are true. But remembering we're not our audience related to the next trap, most people have a very limited understanding of what health means. It's the absence of illness. And if you get a problem, you go to healthcare. Right? They certainly have a very limited understanding of what we mean by public health. And, that even what they understand or the ordinary American understands about public health, of course, that has been mischaracterized and harmed and battered a bit in recent years, right? So I think that this is a public health issue, or this is a matter of public health, is not an effective message. What we can do instead is invite people in to really showing them and helping them see how this is something that affects people broadly, how this is something we can take prevention measures with. It's kind of telling the story of why it's a public health issue instead of just claiming this is a public health issue. All right, and then the overall, the big trap here is that forgetting that we are not our audience. All of these first three things are kind of premised on making a strong, a strongly worded, compelling and rhetorically, clever or something version of our point of view, our side. And so I think that the strategy here, one strategy is to think about looking to evidence to decide what's effective rather than looking to kind of our own personal preferences or beliefs. So that's the third strategy here. So using tested and effective strategies to talk about health topics and public health overall. We've been doing this work at Frameworks, empirical work on dozens of social issues and many hundreds of studies for 25 years now. And we have found that guesswork or gut work, thinking about what you believe, is no substitute for actual research into how to say what we want to say. Overall, we've done this. I just want to point out that we've got an unparalleled research base on mindsets and frame effects. And this includes studies on numerous health topics and science topics. And we live to our nonprofit mission by making this research freely available to mission-driven experts, storytellers, and other communicators. This slide, I'm not going to read it to you, but you can just go on our website and go to the health area and find all of these. This shows just some of our health topics. Our other areas of focus include economic issues and children and families issues. Whichever topic we pursue, we're committed to translating evidence-based ideas and elevating solutions that advance social justice. And we often find that the thing that the field has all, has coalesced around saying is one of the things that ends up, again, falling flat or sending people in the opposite direction. I'm going to draw on a couple findings here from some recent research we did in partnership with the American Academy of Pediatrics. Erin, if you could pop in the link to the toolkit that we did with AAP and also the one we did with the National Association of School Nurses. We see often that the talking points on politicized issues, if we look at them from the point of view of mindsets research, we can see that they're just not going to work as we would hope. So for instance, as there's been kind of a political conversation about pulling back the recommendation that local water authorities fluoridate water in the interest of oral health, I've seen in the news more times than I can count this true statistic, right? Fluoridation can reduce cavities by up to 25%. Now, what I know from our research that we did into American thinking on oral health is that most people think that cavities are a minor personal health issue. Yeah, it might hurt, ooh, or maybe it messes up your smile, but they're not really seen as kind of an overall threat, right, to our health and well-being. And that means if people see it as a personal problem, they believe people should get to make personal decisions about how to manage it. And bodily autonomy plays into that. So my framing insight here from the research we did on how to elevate oral health issues, which in general, again, are seen as minor and personal, it's important to explain how oral health affects overall health. That is new news for most Americans. If you can talk about how, and so what that means is the point of messaging, if we can talk more about how untreated oral disease can spread to major organs, and how few people have consistent access to quality dental care because of the way we handle oral, dental insurance. And that's one reason that it makes fluoridation an important prevention measure. I can't swear that that is going to work in every kind of political context in America, but I am quite confident it will work better than trotting out the statistic again and again that it's reducing cavities by 25%. So that's one example of kind of reconsidering kind of those consensus points from the point of view of our audience and what we know about mindsets. Similar on vaccines, and I really want to encourage you all to dig into the resources we put in the chat on our vaccination research, childhood vaccination in particular. If we keep saying they're safe and effective, well, I know from our research that people, even if they're pro-vaccine, fully vaccinated, vaccinate their kids, all the things, there's an underlying assumption that risks are a real factor that should drive people's personal decision making. And so our framing insight from there is we're seeing that what that meant is what vaccine advocates are doing are often working on the risk side of people's kind of decision-making calculus. They're saying, the side effects are minor, or the risks of getting these disease, ooh, measles, that's bad. Like, so they're trying to either lower the sense of the risk of vaccine or heighten the sense of the risk of the disease. What we found was that those persuasive techniques, other researchers have found this as well, persuasive techniques playing on that risk side of thinking have little effect or lead people to double down on their pre-existing position. But reward framing, we found, helped more on this. So from a messaging point of view, that meant to talk more about how widespread childhood vaccination keeps schools safe, healthy, functioning, and it keeps kids being kids, learning, playing, growing, etc. And that's a different kind of entry point into the issue, and therefore important. I'm going to say a little bit more about this safe and effective in a moment, but I'm sure there's going to be a lot of questions on that. So going back to evidence-based approaches, so thinking about, are the benefits that we're claiming, is that the right approach, right, for the audience? But also talking about ourselves, are we taking the right approach? We need a fresh approach to explaining the value of public health. And that's not an idea I came up with. It's something I'm hearing from the field and all of my colleagues, working in this space are. We know that people tend to conflate the role of healthcare with the role of public health. We know that people struggle how to grasp how prevention works. And we know that people assume that health outcomes are primarily due to individuals' health behaviors. And all of those mindsets make it hard for people to understand what public health does, how it approaches health issues, and why it's essential for society's prosperity and well-being. And so I think there's a lot that we can do. We can talk about health in more expansive and holistic terms. I think that that's likely to be a theme that we're seeing advanced a lot in the upcoming political conversation. And so to the extent that we can take that kernel of idea and fill it out in ways that we see is in line with good policy and practice, that's going to be to our benefit. Another thing we can do is really get better at explaining ourselves and who we are. Instead of just saying we want to prevent things, we can find a good example of how prevention works in our field, and we can use it often because we know it's really hard to communicate the value of prevention. How do you demonstrate the impact of something that didn't ever happen? Concrete examples, showing rather than telling can really help. It's important that we choose some that are unlikely to be controversial or polarizing and use them to introduce our agencies, our work. We want to use that to set the stage for topics that might be more difficult. My current go-to is motor vehicle safety. I'd love to the opportunity to do kind of fresh testing in this area in the current context, but that's another point, another day. So here's an example. So on the left, this is telling kind of what public health is. Public health works to prevent health and safety issues by taking a four-step approach grounded in the scientific method. Define the problem, identify risk and protective factors, develop and test prevention strategies, and assure widespread adoption. This is true, but this is our social analysis. This is our intellectual field-specific understanding of what we're up to. It is not, it should not be our communications analysis. It is not the most effective way of putting our work out there for the public in ways that are clear, compelling, and easy to understand. So instead of telling, we can show. We can just talk about how we want to improve safety at a broad scale. So we look for ways to prevent injuries. One example, restricting new drivers from the most dangerous situations, like driving at night until they have gained experience. That's a very non-controversial topic. I'm sure there's somebody out there that hates graduated driver's license, but the point is not to just find something that nobody disagrees with. The point is to find a place where we can have a productive conversation. You're going to get enough common ground on this for people to get this sense, and we're going to lead people into more difficult topics rather than just saying the stuff on the left, which is frankly jargon and doesn't mean a lot to most people. All right, so if we are thinking carefully about how we are explaining the benefits of our work, positioning the benefits of our work, and explaining who we are, we know that we're doing all that in a flood of misinformation, disinformation, malinformation, whatever you want to call it. But people are saying a lot of stuff that we know isn't true. Anyone who tells you they've got the answer to this for how to do this work, I would encourage you to be productively skeptical. There are some proven practices, more promising practices, but all of us on the globe are in a moment where misinformation can be accelerated and amplified and spread more quickly and more broadly than at any other point in human history. So we're all figuring out how to work with this. Here's my read on what the literature tells us about what we can do. And this will be my almost my last point. I'm a little behind time, but I'm gonna catch up, y'all. All right, so first of all, avoid restating harmful ideas, even if our purpose is to debunk them. One of the strongest predictors of what people believe is true is the number of times they have heard it. So if we are repeating a harmful term like, say, critical race theory, or restating harmful ideas, even if our goal is to debunk them, we've just reinforced them, we've given them more oxygen in society. So we want to instead say what is true and make that clear and compelling, It's important that we work very hard not to be polarizing. So those are the first three steps. It's time, and think about when it's time to stop chasing the misinformation and move to a new frame. Often playing in the misinformation frame is part of our weakness rather than our strength. And then finally, when we can see an evidence-based strategy that is getting across the truth to a broader set of the American public, and it's a frame that it's a narrative we're advancing rather than one we're defending against. When we've landed on that, we need to repeat as an organization, figure out ways to move that information at scale with our friends and allies. So here's an example of what I mean by a couple of those things. On the left, we've got something that's potentially polarizing. So despite growing vaccine skepticism based on misinformation and debunked studies, the scientists who conduct research on vaccines overwhelmingly agree that immunizations make children safer, not less so. This is using that scientific authority as the value. It is reminding people of the controversy. That's a harmful idea that never remind people of something you wish they'd forget, is my advice. And it's talking about risk, right? Safety versus risk. So instead, we can try something that's on the right, which is an invitational rhetoric, right? Rather than an argumentative rhetoric. Whether we tend to vote red or blue, we all agree that schools should be safe, healthy places where kids can focus on growing, playing, and learning. Childhood immunizations are one of the ways we make that happen. Let me explain that to you a little bit more. That type of stance is essential on misinformation. And then again, thinking about when we should stop chasing the misinformation and instead start advancing a new narrative. Our research suggests strongly that advancing a new narrative on childhood immunizations in particular is the way to go. And so that might mean stop telling the stories and bemoaning the fact about the uptake. Like on the left, we got more and more questions about whether vaccinations are safe. People agree, yes, they are. Doctors agree, right? But there's some exceptions, right? Let's give up that narrative and instead talk about the issue of uptake. The issue that even if people want to get vaccinated, they can't always do it. Across the nation, healthcare providers are hearing more and more stories from families about practical difficulties in keeping up or catching up on routine immunizations. Maybe they've got not the right insurance coverage. Maybe they can't take off work to make multiple appointments. Whatever the issue is, we've got a responsibility to make those vaccinations widely available, affordable, and accessible. So that's changing, stop chasing a narrative that's about whether or not you should take the vaccine to one is whether or not we're going to provide vaccines at scale and make it available. It's a different narrative. In doing that or anything else we want to do together, it's important, again, that we put our ideas on surround sound and on repeat. If we are communicating to the public like this, if each arrow is an idea or a message, if we're each talking about these concepts in slightly different ways, if we're creating messages when we need them and craft them for that specific purpose, and we don't think about how that fits into the bigger picture, this is diluting the effect on public thinking. And there just isn't enough of a concentrated dose of our field's view to make much of a difference in the mindsets we know need to change. A commitment to strategic framing as a field can make a difference. We can start to communicate more like this, so that we are each emphasizing and amplifying ideas that go in the same general direction. We've got the boundaries, the blue boundaries there, which says there are some things that we know we have to stop saying because they're undermining us all, right? And this is the way to concentrate our influence rather than dilute it. This is a moment where I feel we're in a moment, a sense of real common cause and a shared sense of urgency. I'm going to pause here and see if my instincts there are true. Walker, could you share the word clouds? And so then we'll see how people are feeling at this moment, what's on your minds, and that will lead us into to a great Q&A conversation session moderated by Sherry. All right, so how are you feeling about the upcoming federal and state administrations and how they might affect? Worried, anxious, concerned, scared are the biggest ones there, and you can see lots of this is a pretty much a beautiful set of synonyms for worried. Okay, next. Are there policies or issues that you are concerned about? If so, name them. Vaccines, very large there, fluoridation, women's health, abortion, of course, misinformation. So yeah, many of these issues that have been politicized, but also I see here, I can't see the tiny ones around the edge, but I can see words that are pointing out about communities, right, that are going to be, that have been, and we have no reason to expect it will stop, or being demonized or marginalized. So LGBTQ rights, gender affirming care, trans rights, et cetera, immigration rights, et cetera. All right, last one. Things we're feeling optimistic about. Oh, okay. Not sure. No, nope. Mental health. I think that that's a place where I agree is lots of room in this political moment to make some progress there. Possibly, we'll dig into that more. Um, just the system. So yeah, I think that there's a lot of work at the states and the local level where systems are being transformed thoughtfully. I see some things, home visiting, maternal health, et cetera. So some places we'll dig into this more and figure out how to follow up on this. But I think that shows that we're kind of in an interesting space. Sherry, let me turn it over to you to moderate a discussion now.
Thank you so much, Julie. That was a great start to what I know is going to be a conversation over a long time. So our first question, I think, is at a relatively high level. And so the question is, how do mindsets like the ones that you describe, how do they develop? And why doesn't everyone adhere to the same mindset?
Yeah. Oh man, this is great. I wish our CEO Nat, who's a leading scholar in mindsets, was here to answer this one. He would love to do it. Mindsets are developed through years of experience, right? So take the consumerism mindset, right? We learn, you're going to the store with mom when you're 2, it's a big deal to go. And we just see it repeated in our material culture and the way people think and talk about things. Often we all have, if they are a true cultural model, a mindset that's widely shared, if we participated in that culture, we're going to have access to the idea, whether or not we, through formal education or some other sort of concerted set of experiences that develops a very different mindset, right? Very different model of how things work. So that may be through faith-based, it may be through cultural, specific cultural practices that are different from the dominant culture, or it could be through formal education. But even if you kind of have trained yourself out of the dominant mindset somehow, it's likely to be available in the culture and so easily reinforced and sparked.
So this idea of they're available to everyone, even if everyone doesn't adhere to them. But does that relate to this idea that people can hold multiple mindsets
Yeah.
simultaneously?
I don't think of us so much as people that have these mindsets and people that don't. It's like a context in which a particular mindset is getting sparked, reinforced, made more salient, being advanced in, I don't know, a speech or a policy or anything, right? It's and that presence of the mindset in the public, or that presence of that discourse, that idea being reinforced in the public square, is going to strengthen it overall. So, and make it it's had more repetitions recently. So it's going to be more front of mind. It may be that we hold a mental model that we don't apply in the same way, right? So, I hold a strong belief in bodily autonomy. And I think that, for instance, gives rise to my belief in reproductive freedom. I don't apply that model to fluoridation in water personally, right? And so the mindset may be one thing, and how it's getting applied to topics and connected to other things you care about, right, is maybe different situation to situation.
Yeah, thank you for that. So the next question is, how do we combat harmful misinformation without repeating it and thus cementing it in people's minds?
Yeah. Often it is, first of all, remembering that your audience, when you are responding to often repeated misinformation, your audience is rarely kind of the misinformation vector, the person who's putting that out there at a high level. It's the people who are also hearing it, right? So part of it is taking a moment and saying, my job here is to steer public discourse in a productive direction, not argue that person down, right? So first it's kind of a pause and reflect moment. From there, thinking about saying what is true. At the moment where the so-called critical race theory was being put on Fox News 200, 300 times a day, right, as a catch-all phrase for any curriculum in K-12 schools that has to do with race or racism or systemic racism, I saw lots of poor principals and superintendents who last time they were on the news, they were talking about the big football rivalry in town. Now they've got NPR in their face saying, do you teach critical race theory? And because it's a manufactured controversy, everyone's like, I don't teach critical race theory. I've never even heard of it. Like, I had to look up what it is. It's something that is taught in law school. That's playing in their frame. With hindsight, what is true? What is true? What do you think this conversation could or should be about? And it's saying, and it's what's at core is, should we be teaching this stuff, right? So saying our curriculum, our civics, our social studies curriculum is as truthful, accurate, grounded in the facts, and encourages our kids to take multiple points of view. And we believe that hiding thorny social issues from the classroom, keeping them out of the classroom, doesn't keep them out of kids' conversations and kids' world. We want them to be having those conversations, with teachers. That would have been an affirmative case, right? And the words critical race theory never came out of my mouth, right? So that's an example. We've got lots more of examples of that in some of the toolkits that Erin flagged for us.
Great. Yeah. So that's an example of saying what is true and what you are doing versus responding and repeating an unhelpful message.
Yep.
Okay. Okay. A couple of other questions. What have you learned about the most effective messengers for conveying the value of public health, especially in the context of overall diminishing trust in government?
Yeah. So we got diminishing trust in lots of institutions, and government, public health being among them. The issue of trusted messengers is going to be different based on topic and audience. So it's a little hard thing to answer in the abstract. But you want people that are seen as credible, yet disinterested, meaning they're not, the people don't seem as kind of have a personal interest, right, in advancing a certain point of view. So for instance, on vaccinations, childhood vaccinations, pediatricians are trusted messengers, school nurses are trusted messengers. They're not the only source people listen to, but they are a trusted messengers. On climate change, years ago, scientists were seen as credible, but not disinterested. They were seen as kind of having a point of view they were trying to advance. People that work at zoos and aquariums and science centers were seen as both knowledgeable and kind of just there for the general public, right? Not having a view. So so looking for those creative places. Often people that have built up personal trust in a space, are going to be effective messengers there as well.
I think a related question is about positionality. So the question, how does the speaker or the messenger's positionality impact their believability and acceptance? So I'm thinking about like community health workers and their positionality as trusted community members that work, live, serve, play with the folks that they're helping along. What else would you say about positionality?
Yeah. So I'll say that, first of all, that this issue is, sometimes we don't have a choice over our positionality. Like our position is our position, our positionality is our position, and we still are in a place where we need to build trust. And so in the vaccine strategies for school nurses, there's a resource in there about building trust in the moment and how to use techniques to build that trust, whether or not the way you show up, right, is the way that instantly demonstrates connection with the group. But those ways of having long-term relationships, being from a community, whether or not you're from that community, showing that you're walking with that community over time, right? Those are strategies that are well known for that type of work. But expressing, if you don't have that type of background, expressing care and concern, explicitly listening more than you talk, or certainly listening before you talk, those sorts of things are, I think, essential.
So one question that came in from the audience is about how to deal with the fact that some communities have been explicitly and intentionally harmed by public health in the past. How do we address that reality in a way that recognizes the harm and addresses cultural sensitivity?
Yeah, that's such an important question. Erin, could I ask you to put in the chat the toolkit on that we did with National Network of Public Health Institutes? And it's specifically, I think it touches on that. It's not all on that issue, but I think there's some important resources there. One of the most important ways to acknowledge the harm is to acknowledge the harm. But to do that not only in kind of light and fluffy ways, like I know, not to come off as it's being performative, but to be very specific about policies that caused harm, and then demonstrating that you understand how those affect today, as well as sorry, I saw something come up in the chat and I lost my chain of thought for a second. Showing how you are doing something differently now to reverse that policy, address that policy, make up for that policy, whatever the case may be, and saying and doing, right? Not just saying it, but making space for genuine community impact partnership, right? The people affected by a policy or a problem are part of the decision-making process about how to address or ameliorate that issue. I think those are some of the most important strategies.
Which are definitely part of public health practice, to be engaging deeply and authentically and in as a power sharing way with the people that we serve. So here's a question about pre-bunking. So a couple of questions have come in about whether pre-bunking can be an effective strategy in messaging, and how do we determine whether pre-bunking will potentially reinforce harmful frames.
So pre-bunking is, for those that may not have heard that term, it's kind of come a clever, recast of debunking. But the idea, I think, like to think of it as inoculation, right? Getting to folks who might be affected by misinformation before they have encountered the misinformation, right? So you want to get the truth out there before the lies hit. There is good evidence that can be effective, but it's difficult to know what you're going to need to pre-bunk on. And especially once a misinformation or mischaracterization of a term or anything like that has been widespread. So in general, we can think about topics that we know are likely to be subject to manufactured controversy or moral panics. They're going to have to do with people in society with less power, right? They're going to have to do with those folks. Thinking through what's within your work that is on those topics hasn't been politicized yet, hasn't been a subject of an active disinformation campaign. And you should be taking an explanatory approach on those issues, right? You don't want every campaign you do to be reactive, right? Or the things that we can use to get a new idea out or a understanding out in a way. But yeah, in general, I think explaining your issues in non-polarizing but in non-persuasive ways, using that invitational rhetoric. Hey, we've got some information that could be of interest and use to you and society, rather than always chasing kind of the last bad idea that's gotten circulated around is going to be a better stance for us.
Okay. I think we have time for one more question before we wrap up. And I think this a question about whether the mindsets that frameworks research has been uncovering, and maybe even that systems rigged piece, the data, are those increasing? What is the data showing? And people are curious about how the COVID pandemic may have changed attitudes about public health and vaccines in particular.
Erin, I don't know if we had this one queued up, but I bet you can find it closely. If you could put a link into the chat into our culture change project page so people can see, that is one method that we developed at, kind of in the midst of the pandemic to be able to do exactly that, track the relative strength or salience of specific mindsets over time. And we can see that they have changed. So for instance, as we started this research in summer 2020, just, as the uprising against the murder of George Floyd and the broader context of police violence was unfolding across America, we saw Americans understanding racism as a systemic issue, not just an issue, not only an issue of interpersonal animus, but more of a systemic issue. We saw that go at very high, be more elevated than what we would have anticipated, and that stayed elevated over time. We have seen that start to reverse to pre-pandemic levels now. So does context affect mindsets? Absolutely, but they are durable and they are widespread. So we know these ideas are along for a long time. They're going to persist for a long time. They may kind of ebb and flow in terms of their salience, but we need long-term strategies for moving mindsets, not just kind of multiplying messages in any given moment.
I think that's a great note to end on in terms of the Q&A. So thank you so much. There are a few next steps that we want folks to still engage in. We want to keep this conversation going. So we're going to put up a poll about what topics would be helpful to cover in the future. And we'd really like you to be specific about what topics would be most helpful for frameworks to incorporate into future webinars and conversations. What type of support would you like the Frameworks Institute to provide next? We've put a QR code in the not the chat, but in the slide there. You can sign up to receive the Frameworks newsletter. That's the best way to get the latest on research and learn about future webinars. There's also some information about where to get some good data for action from County Health Rankings and Roadmaps. And there's also information about following Frameworks Institute on Instagram and LinkedIn for updates, framing tips, and more. This has been a wonderful conversation. Julie, anything you want to say before we sign off?
Oh, just real appreciation, Sherry, for you for making the time to moderate this conversation, and to everyone who not only made the time to have this conversation today, but is clearly doing the hard work of thinking about how to engage our communities more productively in this difficult and uncertain moment. And thank you for the work you do. And we're here to help you with the communications and cultures aspect of it.
Thank you. Have a good rest of your day, everyone.